Let me start with something that took one of my patients completely by surprise. His name was Robert. He was 58 years old. He had been managing type 2 diabetes for about 6 years and high blood pressure for almost a decade. He was on medication for both. He was seeing his doctor regularly. He thought he was doing fine. Then one routine blood test showed his kidney function had dropped significantly. His cardiologist found early signs of heart strain. Nobody had connected the dots for him. Nobody had explained that these two conditions were working together, quietly, in ways that were accelerating the damage. Robert is not an unusual case. In fact, in my 30 years of practicing medicine, this story is one I have heard more times than I can count. And it is the reason I am making this video today. My name is Dr. Wilson. Today I want to walk you through 7 specific practical steps that people over 50 with diabetes and high blood pressure can take to protect their heart and kidneys. Not vague advice, not eat healthier and exercise more. Real, specific strategies. The next part is important, so I hope you will stay with me all the way through. Why this combination is especially dangerous. Before I get to the 7 steps, I want to explain something, because understanding why this combination is so dangerous is what makes everything else click. Your kidneys are extraordinary organs. Every single day they filter about 200 quarts of blood. They are essentially the body's cleaning system. But to do that job, they rely on a very precise network of tiny blood vessels. Here is where diabetes comes in. High blood sugar, over time, damages those tiny blood vessels. It makes them stiff, thickened, and less able to do their job. This is called diabetic nephropathy, and it is the leading cause of kidney failure in the United States. High blood pressure adds direct mechanical pressure to those same blood vessels. Think of it like a garden hose running on too high pressure for years. The walls weaken, the connections fray, the system wears out faster. When both conditions are present at the same time, the damage compounds. The blood sugar weakens the vessels structurally, and the pressure accelerates the deterioration. Your kidneys are being attacked from 2 directions simultaneously, and your heart faces the same double risk. Diabetes increases inflammation and contributes to plaque buildup in the arteries. High blood pressure forces the heart to pump harder against resistance. Together, they dramatically increase the risk of heart attack, heart failure, and stroke. Most people with both conditions are focused on one number, either their blood sugar or their blood pressure. But the science is clear. You have to manage both simultaneously with equal attention. And the good news is that many of the steps I'm about to share address both at once. Trick 1. Know your target numbers. This sounds simple. It is not. I regularly see patients who know their blood pressure is a little high but could not tell me the actual number, or patients who know their A1C is above normal but are not sure what their target should be. For someone with both conditions, most guidelines suggest keeping blood pressure at or below 130/80. For blood sugar, your A1C target should be a conversation you have specifically with your own doctor, based on your age, your medications, and your overall health. But here is the key. You need to know your numbers. Write them down. Keep track at home if you have a blood pressure cuff. Understand what you are aiming for, and check in regularly on whether you are hitting that target. Knowledge is the foundation of everything else on this list. Trick 2. Reduce sodium. More aggressively than you think, sodium restriction is one of the most powerful tools available for managing both blood pressure and kidney health. Most Americans consume between 3,400 and 4,000 milligrams of sodium per day. For people with hypertension and kidney concerns, the recommendation is often under 2,000 milligrams. That is a significant reduction. And the tricky part is that most of the sodium in the American diet does not come from the salt shaker. It comes from packaged foods, restaurant meals, canned goods, and processed meats. 1 can of soup can have over 800 milligrams of sodium. A fast food sandwich can easily have 1,200 or more. Even healthy-sounding options like cottage cheese or canned beans can carry substantial sodium. The practical tip here is to start reading nutrition labels specifically for sodium, not just calories. And when you cook at home, Use herbs, spices, lemon, and garlic to add flavor instead of salt. Cooking at home is one of the single best things you can do for sodium control. Trick 3. Understand how your medications interact. This is one of the most important things I can tell you, and it is something a lot of patients never think to ask about. Certain classes of blood pressure medications are specifically beneficial for people with diabetes because they also protect kidney function. The most common examples are ACE inhibitors and ARBs. Drugs like lisinopril, enalapril, losartan, or valsartan. These medications do not just lower blood pressure. They reduce pressure inside the kidney's tiny filters directly, which slows the progression of diabetic kidney disease significantly. If you have both conditions and you are not on one of these medication classes, that is worth asking your doctor about. Not demanding, just asking. On the other side, be aware that common over-the-counter medications like ibuprofen and naproxen can raise blood pressure and reduce kidney function. Many patients take these regularly for pain without realizing the impact. If you are using them frequently, please talk to your doctor about safer alternatives. Trick 4. Be smart about protein. This one surprises a lot of people, especially those who have been told protein is good for them. Protein is essential. We need it. But when the kidneys are already under strain from diabetes and high blood pressure, a very high protein diet can accelerate the damage. The kidneys have to work harder to process excess protein, and for kidneys that are already compromised, that extra work matters. I am not telling you to eat a low-protein diet without medical guidance, but if your kidney function tests are showing early warning signs, a conversation with your doctor about protein intake is absolutely worth having. What I usually tell patients is this: focus on the quality of protein rather than maximizing the quantity. Lean proteins like fish, chicken, eggs, and legumes in moderate, appropriate portions. And minimize processed meats, which come loaded with sodium on top of the protein. Trick 5. Move your body in the right way. Exercise is one of the most powerful interventions we have for both blood sugar control and blood pressure management. But here is what most people miss. The type of exercise matters. For someone over 50 with both conditions, the goal is consistent moderate activity rather than intense sporadic bursts. 30 minutes of walking 5 days a week can meaningfully lower both blood pressure and blood sugar over time. It improves insulin sensitivity, meaning your cells respond better to insulin, and it reduces the workload on your heart gradually and safely. Here is something interesting. A simple 15-minute walk after meals has been shown to reduce post-meal blood sugar spikes more effectively than a single 45-minute walk earlier in the day. Timing matters. Resistance training is also valuable. Light weights or resistance bands 2 or 3 times a week can improve glucose metabolism significantly. If you have not been active recently, start with a 10-minute walk after dinner. That is it. Build from there. Consistency over intensity, every time. Halfway check-in. I want to pause here for a moment because I think it is worth acknowledging something. If you have both diabetes and high blood pressure, and you have been feeling overwhelmed by it, the medications, the monitoring, the diet, the appointments, that feeling is completely understandable. These are genuinely demanding conditions to live with, especially when you are managing both at the same time. But here is what I have seen in 30 years of practice. The patients who do the best are not the ones who do everything perfectly. They are the ones who make a few consistent, well-chosen changes and stick with them. That is it. We have 2 more tricks to go, and I would argue they are the ones most people overlook. Stay with me. Trick 6. Test your kidneys regularly. Here is something that genuinely frustrates me in clinical practice. Patients with diabetes get their A1C checked regularly. They monitor blood sugar at home. They know their glucose numbers, but many of them have never had a thorough kidney function panel, or they had one years ago and assumed everything was still fine. Early kidney damage from diabetes and high blood pressure is silent. It does not cause pain. It does not cause obvious symptoms until the damage is already substantial. The only way to catch it early is through testing. There are 2 tests I want you to know about and ask for by name if needed. First, eGFR, which stands for Estimated Glomerular Filtration Rate. This number tells you how well your kidneys are filtering. A number above 60 is generally considered acceptable. Below 60 is a sign of reduced kidney function. The goal is to catch a declining trend early. Second, urine albumin to creatinine ratio, or UACR. This test looks for protein leaking into the urine, which is one of the earliest signs of kidney damage from diabetes. It can show up on a test years before your GFR starts to decline. If you have not had these tests recently, please ask your doctor for them at your next appointment. They are simple, they are inexpensive, and catching a problem early makes an enormous difference in what you can do about it. Trick 7. Take stress seriously. I saved this one for last because I know it is the one most people are tempted to skip past. Stress management sounds soft. It sounds like advice from a magazine, not from a doctor. But I want to be very direct with you. Chronic stress is a physiological event. When you are under stress, the kind that does not go away, the kind that lives in the background of daily life, your body releases hormones like cortisol and adrenaline. These hormones raise blood sugar, they raise blood pressure, they promote inflammation, they increase the burden on your heart and kidneys. This is not a minor effect. In patients I have seen over the years, poorly managed chronic stress has actively undermined otherwise excellent diabetes and blood pressure control. I am not telling you to eliminate stress from your life. That is not realistic. I am telling you to take it seriously as a health variable and address it deliberately. What actually helps is regular physical activity, which we already covered. Getting consistent sleep, because poor sleep raises both blood sugar and blood pressure. Social connection, because isolation is a genuine health risk, particularly for older adults. And if the stress in your life is significant, talking to a counselor or therapist is a legitimate, effective medical decision. Not a luxury, not a weakness. Warning signs to watch. Before I close, I want to give you a short list of warning signs that should not be ignored if you have both diabetes and high blood pressure. Swelling in your legs, ankles, or feet that does not go away. Foamy or unusually dark urine. Sudden or severe headaches, especially at the back of the head. Shortness of breath with normal activity or when lying down. Fatigue that is significantly worse than usual, especially combined with any of the above. None of these are something to wait and see about. If you experience any of them, please contact your doctor promptly. A personal word. I want to say something directly to you before I close. If you are over 50 and managing both of these conditions, you are carrying a real weight. Between the appointments, the medications, the monitoring, the dietary changes, and the worry about what the future holds, it is a lot. And the people around you may not fully understand what that is like. I want you to know that every step you take to manage this well matters. The morning walk, the sodium check on the nutrition label, the kidney test you ask for at your next appointment. These are not small things. These are the things that keep people living well, independently, actively, with quality of life for years longer than they would otherwise. I have watched patients in their 60s and 70s make meaningful changes and genuinely turn things around. Not cure everything, but stabilize, protect, and in many cases improve their numbers significantly. It happens. I have seen it. And the fact that you are here, watching a video like this, looking for real information, that tells me something about the kind of person you are. You are someone who takes this seriously. That puts you ahead. Let me bring everything together quickly. Trick 1. Know your target numbers for both blood pressure and blood sugar and track them. Trick 2. Reduce your sodium intake, especially from packaged and processed foods. Trick 3. Understand your medications and ask whether you are on a kidney protective blood pressure drug. Trick 4. Be mindful of protein quantity, especially if your kidney function tests are showing early warning signs. Trick 5. Move consistently, especially with a short walk after meals. Trick 6. Get your kidney function tested regularly. Ask for your EGFR and your UACR by name. Trick 7. Take stress seriously as a health variable and address it deliberately. None of these require a special diet plan, an expensive supplement, or a complete life overhaul. They require information, consistency, and a willingness to be proactive with your own health. If this video gave you something useful today, the most meaningful thing you can do is share it with someone who needs it: an older sibling, a parent, a spouse who is managing one or both of these conditions. If you have a question about anything I covered today, leave it in the comments. I read everyone. Thank you for taking the time to watch this. I will see you in the